Introducing Peridan Concentrate, a sterile veterinary device for the reduction of surgical adhesions in horses and foals. Adhesions are a complication following abdominal surgery in approximately 20% of procedures. Adhesions can result in post-operative pain, repeat operations, or euthanasia. Preparing Peridan is easy and quick. The technician removes the Peridan concentrate with a standard syringe and needle and mixes it into a bag of lactated ringer solution, then hangs it onto an IV pole. The lactated ringers should be kept in an incubator, as the Peridan LRS solution should be warm when instilled into the abdominal cavity. For a 500 kilogram adult horse, Peridan concentrate is prepared in advance of surgery by diluting 50 ml of Peridan in a 5-liter bag of lactated ringer solution. This admixture is hung from the IV pole and a large bore irrigation set is attached. For foals, mix one 5 ml vial of Peridan concentrate with 1 liter of warm lactated ringer solution. Toward the end of surgery, after the surgeon has replaced the intestine and is closing the incision, the irrigation tube is placed into the abdomen. The site is then closed snug around the tube, and regular gravity flow is initiated until the entire volume has emptied into the abdomen. An alternative method is to cut off the corner of the bag holding the Peridan lactated ringers mixture and slowly pour it into the abdominal cavity. Published data on Peridan concludes that when used as shown, it is safe and effective for the reduction of both incidence and severity of post-surgical adhesions in horses and foals. In a controlled efficacy field study, 12 foals were treated with either diluted Peridan concentrate or control lactated ringer solution. Results showed that animals treated with Peridan had a 65% decrease in the number of adhesions and a 76% decrease in the severity of remaining adhesions compared with control. Peridan had no clinically significant effect on the hematologic, biochemical, or other parameters investigated in the study. The investigators concluded that the use of Peridan was well tolerated and effective in the reduction of surgical adhesions. In a controlled safety field study, 12 adult horses undergoing coeliotomy and anastomosis were treated with either diluted Peridan concentrate or control lactated ringer solution. Results showed that Peridan was safely administered. The investigators concluded that Peridan may be safely used in clinical cases to reduce abdominal adhesions following intestinal surgery in horses. In a third study, 36 rabbits undergoing abdominal pelvic surgery were treated with either Peridan concentrate, sodium carboxymethylcellulose, CMC, or control lactated ringer solution. Results showed that both simulation of running the intestine with Peridan or instilling it into the abdominal cavity had superior efficacy compared with CMC or control. In a fourth multi-center study of 33 horses and foals treated with diluted Peridan concentrate without randomization or controls, the investigators concluded that there is some evidence of a favorable long-term outcome with regard to survival and reduction of colic, particularly considering the number of neonates and the high proportion of horses with small intestinal lesions, adhesions, and that underwent repeat coeliotomy. For full safety data, including contraindications, precautions, and warnings, please refer to the package insert.